Welcome to the KellFire Show. I'm Dr. Kelly Barron, and today I am so excited to have with me Donna White. She's had 30 years experience in the field of hormones, and she is known as the Hormone Authority. Donna is also the founder of BHRT, which she will tell us a little bit, if you will, in just a second. And she's also the author, this is my first author, the author of the Hormone Makeover, which is a fascinating book. So Donna, welcome. Thank you for coming on and taking the time out to be here with us. And if you just give us a little background on yourself.
I'm delighted to be here, and I really think we have something that your audience is going to want to hear today.
This is a huge topic, and I was so excited that you were going to be able to come on and talk about it because we haven't. And I think this is one of the biggest things I get asked all the time is about hormones. What can I do? What are my options? What are the myths,
Yes, hormones are so confusing. And not only are they confusing, people are scared of hormones and they don't know what to think. I mean, do hormones cause breast cancer? Do they cause heart disease? Are they the magic cure for menopause?
Yeah.
There's so much misinformation. So I'm so honored to be here to talk through that with you.
So how did you get started in this field?
Oh, goodness, that's a bit of an embarrassing story.
No,
we have to go there. So the reason why I got into this is about 30 years ago, I had a horrible case of PMS. I was mean as a rattlesnake once a month. I wanted to bite everybody's head off. I had terrible period problems and acne. I looked like I was in puberty. And I realized, hey, wait. This is hormones. Something's going on here with my hormones. But Kelly, I didn't want to take an antidepressant. I didn't want to take the birth control pill. I just wanted to fix the problem. I'm not speaking against that, but at the time, I just wanted to fix what was wrong. So then I started learning about hormones and hormone balance and started going to all the medical conferences and really taking this information in, so much so that it just became a passion within me to share it with other women, like what you do on your podcast here. You want women to have credible information that they can use that will help them. And I have literally been on hormones, bioidentical hormones, which we'll talk about that, for 30 years. I'm like the poster child.
I was just going to say, when you look up the bioidentical hormones in the dictionary, there you are, just smiling.
I'm the poster child. I mean, I had the PMS. I've gone through perimenopause, menopause. I've been postmenopausal for 10 years. I just turned 62. So I know what it feels like to have those imbalances, and I don't want any woman to have to suffer the way that I did.
Rachel and I actually just had this conversation this morning because I was like, I am going to rip heads off today. Why do we have to go through this? So knowing there's an option out there that can actually help, that's amazing. So tell us what made you decide to author the book?
Because I want women to have the information. So in my book, The Hormone Makeover, I wanted women to understand some of these myths and misconceptions around hormones so that they can get to the truth, and also to help them understand, well, what are symptoms of hormones? Because some women don't even realize some of the issues that they have are actually related to hormone imbalance. So I put all of that in, explained all of that, and then what each hormone does, because every hormone's different. There's the hormone cortisol, the stress hormone. So we probably all know what it feels like to have too much cortisol. Yeah. Of course, there's the estrogen, progesterone, testosterone, thyroid, all of the hormones. So I explain in the book what each of these hormones do. But the most important thing I put in there, I mean, how many times have you read a book and, okay, oh, this sounds great, but then what do? I put the how-to in here.
Right, that's
Here's
what I like.
how to get hormones into balance. Here's how to work with your provider. Here's how to test the hormones. Here's some information about the prescription. So I just want to empower women like you do.
And I think that's so important because we all know when we go to the doctor, we've got our allotted, 5-7 minutes that they can spend with us, and to try to break down hormones in 5 to 7 minutes and options, it's impossible.
Absolutely. And even as a provider, you know yourself, it takes some time to explain things and educate the patient.
So if you could give us a little information on hormones, how do hormones work in your body?
Well, that is such a good question. So hormones, if we think about hormones as a lock and a key. So hormones are like a key, and you have to put them into the lock to open up and get the benefits or walk into the room or what have you. So hormones have to get into hormone receptors to deliver their message. We call them chemical messengers. So hormones deliver chemical messages like build bone, oh, it's time to have a period, balance blood sugar, oh, it's time to think clearly, we need our brain today, or ooh, hubby's looking really hot tonight. So hormones deliver messages to our cells, and they affect almost every single physiological aspect of our body. They're so important. We've kind of already alluded to the fact that hormones affect us emotionally,
right?
Emotionally, physically, and mentally, and our cognition. So hormones affect every single aspect of our health and well-being, and they're so important. But here's the problem. When they're out of balance, we have symptoms and things don't go right.
Right. You just gave the best visual. Like, I don't know, Rachel, if that gave you a visual, but for me, as soon as you said lock and key, I imagined this, like, these little, like, bubbles, just unlocking and then just going as messengers. That was such a good analogy.
And here's why that's so important, Kelly, is that when it comes to hormones, some people are very afraid. They think, oh, okay, they cause cancer or heart disease. But that's analogy is how we can define, well, what are synthetic hormones, or what's HRT? What are these bioidentical hormones that people are starting to hear more and more about? So hormones. There are different versions of hormones. There's conventional hormones, there's these bioidentical hormones, and so when it comes to replacing hormones, we have options. We can use animal-derived hormones. I don't recommend that. We can use synthetic hormones. I don't recommend that either, because those have side effects. And they have side effects because they don't have the same chemical shape to fit into the hormone receptors as our human hormones. So if you think about the lock and key, so it's like putting the wrong key into the lock. It doesn't fit well, it doesn't open the door, the little bubble doesn't pop like you said, and that's why they have side effects. So when it comes to replacing hormones, I recommend bioidentical versions because they have the same molecular shape. They're exactly the same. They're an exact replica of the hormones that our bodies make, like estrogen, progesterone, testosterone. And since they have the same chemical structure, it's like the same exact key. It fits perfectly into the lock. You get the benefits. The body knows how to process the bioidentical hormones, clear them out and get rid of them. But the synthetic hormones, they are never supposed to be there, and they cause the side effects. Our bodies don't clear them out. So as we're having this conversation, the kind of hormones that we're talking about, as we talk about benefits or what have you, are the bioidentical versions of hormones.
So can you get into that a little bit? Where are they derived from? Where are they made from?
That is a fabulous question. So way back in 1942-43, an American chemist learned how to, he realized that there's a plant, a wild yam plant, and some of the molecular constituents in that plant have a similar molecular structure. If you think way back to chemistry, what chemical structures look like, very similar to the human hormones. Well, he learned how to start with that plant precursor and convert it into, through a series of steps in a lab, an exact match to human hormones. So you can convert it into melatonin, estrogen, testosterone, DHEA, any of the hormones, and then we can use them with whether it's patch, cream, pellet. There's different ways to use the hormones, but they originally started from plants that's almost 80 years ago now, and we do have those as an option to use when our hormones are low. But here's a problem. The problem is far too many women don't realize that some of their symptoms are caused by hormone imbalance. They're just told, oh, you're just getting older, or you just eat too much, you don't exercise enough. That frustrates me.
Yeah, it's almost like just accept it and change your
No.
lifestyle a little bit.
Exactly.
It's your fault kind of thing, that
Yes,
mentality.
yes. That's why I'm so glad you had the show where people are able to talk freely about the hard things and get the information out. So some of these symptoms, if it's okay, that women don't always connect to hormone issues are fatigue, like just low grade energy throughout the day, or that afternoon fatigue.
That afternoon crash.
Yes, or fatigue at night, like you just can't wait to get everything done, the kids to bed, dinner done, all that, so you can laundry folded, all the things, so you can go to bed. So fatigue, low-grade fatigue is one possible symptom, and then sleep, like not being able to get to sleep or stay asleep. Like, you put your head on the pillow at night, and all you can do is thinking about what you could have done, what you should have done, what you have to do tomorrow, all the things going on in your brain. But for some women, they can get to sleep, but they can't stay asleep. They wake up at 3 o'clock, 4 o'clock, 5 o'clock, and they can't get back to sleep.
Right.
Oftentimes, that is due to hormone imbalance. So that's fatigue, that's sleep, and then foggy thinking. Can't remember what you went to the pantry for. What was your name again? What did you just read? What was that paragraph I just read? Foggy thinking. We have to have good hormone levels for our brain to power and run efficiently. So we got fatigue, sleep, foggy thinking. Then there's mood disorders like crying at commercials.
Yes.
Being weepy or irritable or angry 1 minute, crying 1 minute, angry, just mood swings or anxiety. That's not normal. So that's another common symptoms that people don't connect to hormones. And then, the PMS, the menopause, the hot flashes, the vaginal dryness, the sex drive. Most people do connect that to hormone imbalance.
Those are like the big ones.
Yeah, but two more. Weight gain.
Yeah.
Unexplained weight gain. It's like somebody changed the margins.
With overnight almost. I feel like it was overnight that all of a sudden I was like, why do I have this little belly? Where did this come from?
And so some people struggle their entire lives with weight, and some people find that it hits them in perimenopause or menopause. Every single hormone affects metabolism, whether we're able to maintain, which is kind of what you're saying, or to lose when we've really put the effort in, but it's not working.
It's so frustrating.
How discouraging is that? Some women, they just give up because nobody's really looked at their hormones to see what the problem is. So any hormone that's out of balance, whether it's estrogen, progesterone, thyroid, cortisol, DHEA, testosterone, insulin, all of the hormones, any of them, if any of them are out of balance, it interferes with our metabolism. And here's the last symptom. Aging. Oh, forgot to tell you, most women gain 20 pounds at menopause.
Yeah, and it's become such an acceptance thing.
I know.
And then going into extremes because everything that they used to be able to do no longer works.
Exactly. And that very last symptom is aging. Women, as we go through menopause, estrogen levels drop, we make less collagen, women lose like 30% of their collagen at menopause.
Absolutely.
And it's like, what happened? Last year I looked okay. Well, it seems to happen rapidly. However, if women have normal or adequate hormones, optimized hormone levels, that can slow down, prevent, and reverse aging and collagen loss. So there was one study that came out that found that women with low estrogen look 7 years older than women with normal levels of estrogen.
I'm going to be right back. I'm going to go get my estrogen test. I'll be back.
Pause for a break from our sponsor.
Pause. I need to go get that estrogen level checked.
Yes.
I kind of think of and you can tell me if I'm wrong, it's almost like with hormones, because there's so many players involved, that's like a domino effect. If one is out, everything just starts to just fall in ways that we didn't necessarily think of, or like you said, we don't attribute to menopause. We think of hot flashes, night sweats, vaginal dryness, low libido. I mean, those are the big ones right there. So HRT, can we get into that just a little bit more about exactly what that is? Because I think a lot of women hear the word and then they hear and read through the Google machine. you know, all these different stories. And it seems, I mean, I'll be honest, it seems a little scary.
It does. And who do you believe? You have, celebrity doctors and, Dr. Oz, Oprah, they're all talking about bioidentical hormones, but then you go to your gynecologist and they're saying, oh, no, hormones cause breast cancer, So what's a woman to do, So that is why it's so important to have these discussions. And whenever we are talking about hormones and bioidentical versions of hormones, what I really want your listeners to understand, or your audience to understand, is there is so much research behind the use of bioidentical forms of hormones, research starting way back in the early 70s. So there's validation.
Nobody talks about that, by the way.
I know.
Nobody says it's been ongoing.
It has been, and the bioidentical hormones have been used for nearly 70, almost 80 years in Europe. That's what they have used. But let's talk through a little bit of these scary things like breast cancer.
Right.
Because
yes,
that's
please.
a scary one. Oh my gosh, every woman has that thought in her mind, or that's my assumption. So what does the research really say about hormones and breast cancer? Well, there was this one study that came out in 2001. Now, remind you, prior to 2001, women had been on hormones for a number of years, since the 70s, and it was common use, and we weren't seeing really not that kind of issue. So there's one study that came out then. It was called the Women's Health Initiative, and it threw hormone replacement therapy into a tailspin because the study was done on horse urine estrogen and synthetic progesterone. And those women had increased risk of blood clots, increased risk of heart disease, and breast cancer. But that was horse estrogen,
right,
and synthetic progesterone. And unfortunately, far too many don't know the difference. But 18 years later, after the original authors of that study looked at it again, and found, hey, wait a minute. In the women that took estrogen, only the estrogen, not that synthetic progesterone, which is an awful hormone that should not be on the market, another story. But the women that had taken that estrogen actually had a 23% less risk of breast cancer. Now, we have many other studies that corroborate this. Estrogen actually reduces the risk of breast cancer. Some studies say 30%. That one happened to say 23%. Other information, a number of studies, not just one, but numerous studies back that up. And what we have also found is that if a woman had taken hormones, then got breast cancer, if she had been on hormones, if she had taken estrogen, 44% less risk of dying from it. Hormones are protective, and that's estrogen. Progesterone helps prevent breast cancer. Bioidentical progesterone, not synthetic. There was one study back in 1981, the year I graduated from high school, that found half of all breast cancer, I did say, half of all breast cancer could be prevented by having a normal level of progesterone, and that was done by Johns Hopkins.
Wow.
If that doesn't get your attention,
where is this study?
Published in Epidemiology. So, and then many other studies say the same thing about progesterone, how protective of our breast tissue. Even testosterone, we need a little testosterone.
Yeah.
Testosterone may reduce the risk of breast cancer in women as much as 40%. Hormones are protective. So that's an angle on breast cancer that women need to understand.
Nobody's talking about this.
But
we're not loudly enough, I should say.
Right, but you are. We've got the leader here, trying to get the word out. So that's breast cancer, but what about heart disease? When you use bioidentical forms of hormones, they're protective. Women on hormones have less risk of cardiovascular disease, less heart attacks, less risk of stroke, so they're protected. And here's just a quick summary. I'll give you a quick summary of what the research has shown hormones to do. Prevent breast cancer, reduce the risk of heart disease, reduce the risk of Alzheimer's and cognitive decline. Okay? Women on hormones live longer. That's been shown in research repeatedly. They have better quality of life, less risk, and better quality of life means better sleep, better mood. Women on hormones look younger. Women on hormones gain less weight at menopause. They have less risk of bone loss. So the benefits are wonderful. I mean, who doesn't want that? I mean, I don't sell them. I just want them.
How? And this is a question that was just popped into my brain. Is there a point in your life, like I'm 54, so if there's a point in your life where you're like, well, no, don't, like, is it too late is what I'm trying to say. Like, when is it too late? When is it just not beneficial anymore? Or is there a particular, deadline, if you will?
Yeah, that is a common question. Whenever you want the benefits, it's never too late. And that is a common misconception. So, I mean, you're just picking up on all the right things, Kelly. Some women think they're too young to have hormone problems. Oh my goodness, no. How many young women have PMS?
Oh, yes.
Or polycystic ovarian syndrome, or, stress hormone issues in their 20s. But then, to your point, as women age, it isn't too late to start hormone therapy. Even 80-year-old, 90. I mean, I wish that the sooner you start, the more benefit you'll get. If you're low, you don't take hormones just to be taking them. You test first. But anyways, it's never too late to feel better and to get the benefits of hormones.
Okay, so the next question would be, if you start taking hormones, you start HRT, there's also that misconception you're on it for life. Now, does that mean you're on it for life because there's going to be detrimental effect? Detrimental that's probably too doom and gloom of a word, but is your life going to crash if you go off of them, or can you just go off of them if you're like, okay, this is, the benefits obviously might go away.
They do.
But is it like you have to stay on, or your life is horrible?
No, there's no withdrawal, because you're right. Some medications, like psych meds, if you go off, that's dangerous. No.
Okay, and then my next question is forms of bioidentical hormones that are available. Like, I'm sure everyone's like, do we have to have shots? Is it something we take sublingual? Is it a cream, or is it all of them?
It is. It's all of them. And what is so nice, as women, we like choices.
I do love a good choice.
I know. So I don't want to, and you don't want to go to a doctor for bioidentical hormones that says, oh, you have to do it this way. No. So bioidentical hormones are available in creams. There is an estrogen patch. There are shots. There are pellets. There are, vaginal forms. And some you can take oral, but never oral estrogen.
Okay.
So there's a variety of different ways we can get these hormones into our bodies to whether it's restoring balance or correcting hormone deficiencies.
Okay, and I'm pretty sure we all know the answer to this one, but do you have to see a medical provider to get them? So I know I've seen a few things that are over the counter, but they're not, they're just, there's a few creams or this or that's out there.
There are, and I'm not opposed to the over-the-counter creams, because you can get progesterone over-the-counter and DHEA and, of course, melatonin, but ideally, you don't go it alone, because how do you know if you're on target? So in some of the progesterone creams in the better health food stores, they are good. Some aren't, but some are. But ideally, yes, you work with a practitioner that is certified and well-versed in all of those different dosing forms and the right methods to test, and the other components, such as nutrition and supplements and lifestyle changes, to get women feeling their best and living their best life. Just because we're 50 or 60, I'm just getting started.
No, we have another whole half of our life left to live.
I want to look and feel good, don't you?
Absolutely. There's this whole stage that I talk about now, and you know all about this, that where our lifespan is now, it's increased because of technology, modern medicine, and those factors. So, as our biological clock, our main purpose to have children has wind down, it used to be then we immediately jumped into grandma mode, or because our lifespans were shorter, our children are having their children earlier, but now it's lengthened, and now our children are having their babies later in life. So we're finding ourselves in this time period not having to take care, and our parents are living a little bit longer, so not having to take care of our parents, not having to take care of grandchildren. Our children are out of the nest, and they call it the wild woman stage.
I love that.
And this is exactly what you just said. So now we have this like maybe 10-ish year, it varies, but this time gap where we can do things for ourselves, take care of ourselves, concentrate on ourselves. Why wouldn't we want to look good and feel good during this stage where we have all this freedom now we didn't have before?
You're so right. You don't have to suffer through menopause. We can celebrate it. We don't have periods anymore.
Yeah, I just said that to Rachel. I said, I used to always say, my thinking was always, I don't ever want to lose my period because I'm going to lose what it means to be a woman. And I said to her this morning, I said, no, that was false thinking. I take it back. I can't wait till it goes. I take it back. That's when I'm going to be a woman. That's when I'm going to have my best life right there.
Yes, no, we deserve to look and feel good, and hormones is one very important piece of that anti-aging puzzle.
So let's say you decide to go into the world of hormones. What do you do to ensure, as you're on them, that your hormones stay in balance? And if you come off, what do you have to do?
Testing is very important. So even before you go to see your provider, a challenge, admittedly, it's difficult to find a medical provider that is well-versed and trained in hormone balancing. That is bane of my frustration. It is frustrating. There's 75 million women in the United States in menopause. 75% of them that go to their medical doctor walk away without help.
I think you need to say it again.
Okay.
75 million women
That's
are
a lot of hormonal
currently in menopause, and 75% of us walk away frustrated with our hands in the air.
Yeah, because providers aren't trained, and it's not their fault.
No, not at all.
It's not their fault. They're not taught in medical school. So for your example, yourself, or for medical providers that want to learn how to get women's hormones back into balance, you have to go get out training that you didn't get in medical school.
Oh, exactly. It's like specializing.
It is. And so medical providers have to step out of the box, go find the right training, learn these ways to get hormones in balance, how to prescribe the bioidentical hormones, how to test for them. So that's where it starts, is finding a qualified provider that knows what they're doing. That's your first step. If you're trying to say, well, is it my hormones? Find that provider that is well trained. And is it okay if I share my tips on how to do that? So,
okay, you better. I'm hanging on to every word you're saying.
So, you can do your Google search for your area, and when you call, the provider that they're saying that they do bioidentical hormones, you want to ask them a couple of questions. You want to ask them how long they've been doing bioidentical hormones, and do they test all of the different hormones, not just estrogen and progesterone. We want our thyroid, our insulin, our stress hormones. We want, just because of what you said earlier, all these hormones work together. So we want thorough testing of all of the different hormones. And then we want to work with a provider that knows all of those different dosing forms. If you're looking in the I was going to say phone book, but I just aged myself.
No, I was right with you too. I was picturing the yellow pages. I was like, okay, where's the payphone?
So if you're looking online and they only do pellets, for example. Now, I love pellets. I have an estrogen pellet. I use creams. I use a variety of things. But anyways, if they only know how to do one dosing form, don't go there. Because if you don't want a pellet, or you're not a candidate, you need a medical provider that knows all of the different nuances and all the proper testing. Another way to find a medical provider is to call a local compounding pharmacy, because they know who's prescribing.
That's a good tip.
They also hear feedback. Oh, this doctor, we don't like them. Or they also, oh, this doctor's great. Their patients love them. Do a little extra homework.
That's a very good tip. Okay, I'm going to ask you about the Hormone Makeover. Tell us a little about the book.
So the book, shameless plug, is an international bestseller.
Get it. Amazon.
So, it's a quick read. And one of the cool things I did, I'm busy. You're busy. I put chapter summaries at the end of every chapter so you can go back and, just pick up.
No, I think that's brilliant. That's like the original Cliff Notes. You're like, I've already provided you with the Cliff Notes, right there.
But here's the important part.
Yeah.
So the information is in there. And I do go into some of the the myths of being too young or too old or the cancer and some of the research. But you can look at symptom questionnaires. It's more than just those few handful of symptoms that I ran through to help women identify. But here's something important is in the book, is how to test hormones. Because do you mind if we go there a little bit?
No, I was going to actually ask you, and my brain jumped to something else. So yes, please do.
Because there are different ways to test hormones. There are 4 ways actually. There's saliva testing is one option. Serum, which is the usual blood test when you go to your doctor or LabCorp or wherever. Serum, the venipuncture. Dried urine. And capillary blood spot. That's like a finger prick and it's whole blood. A little bit different from serum. So there's 4 ways that you can test hormones. Now back to interviewing your doctor, so to speak. You want a medical provider that knows how to do all of them. Yeah. Not just one. Oh, I only do saliva testing. If you have a medical provider that they only do it this way, I would not recommend that. So there are limitations and benefits to all of those types of testing. So if you're not on any hormones at all, none, not even the pill, no hormones, you can pretty much test everything in serum, and maybe that runs through your insurance.
Right.
Except there's one caveat, the stress hormone cortisol. And that's so important to test. You need to test the stress hormone cortisol in saliva or dried urine because you have to test it 4 times during the day. Morning, noon, evening, and night.
Interesting. That makes sense.
Because from your training, there's a diurnal curve. The cortisol goes up in the morning and it gradually drops down. So cortisol has to be tested differently. So it's pretty simple. If you're not on any hormones, get your baseline testing, all the right testing there in that book, how to, everything that should be tested, and a well-trained provider should know that. Except get them done in blood and then have your saliva or dried urine check cortisol. It's a little more nuanced once you're on different hormones. Whether you're on a cream or a patch or a pellet or a pill, that might change the how you monitor that particular hormone. But it's pretty much that simple.
So if you're on hormones, and is there anything that we should look out for to go, something's not right? Is it just feeling off, or like I need to go back to my provider and I might have a dosage changed?
That is such a good point. So you have this doctor brain. So once you are properly tested and put on a treatment plan, and it might include a couple of different hormone prescriptions, certain supplements, because those are important as well, and some things you might need to change about your diet and lifestyle. So once you're on a treatment plan, you do need to have, at about 30 days, you should have a call with your provider and let them know how you're doing. Because here's the point, nothing should get worse. Okay. And if a provider knows what they're doing, they'll start with lower doses and work up. So maybe not everything is ameliorated in 30 days, but if you start taking hormones and all of a sudden you have this breast tenderness, you need to call in. Okay.
I remember my other question from way back. How quickly do you start to see changes?
For some women, very rapidly. If you're very low in hormones, let's say you're very low in estrogen, and your doctor writes a prescription for a bioidentical estrogen, sometimes a week. But to really get your hormones in balance, you really do need to give it a good 90 days. So after that first 30 days, your provider, the medical provider, might adjust things, but you need to, a little bit. You can't adjust it 5 or 6 times and then test. You need to stay on a stable dose. So normally most practitioners will repeat the testing in 90 days. And then every 6 months, 3 to 6 months, depending on how you're doing.
One of the things that Donna has that's very exciting, especially for providers, is your training academy. Can you give us a little blurb on that? Because I do think that there's some women out there that this would be very helpful if they're providers out there. We talked about different, whether you're alternative healthcare providers, doctors, MDs, chiros, nurses.
Yes. So, because I've been in this field for 30 years, and I mean, you might have picked up that I have a little passion about
Just a little bit, about this much.
I'm definitely a hormone geek about hormones and the studies and everything. So I've been training medical providers for 2 decades, and over 5 years ago, I decided to launch an academy to certify medical providers in how to get hormones into balance. So now that we're into our 6th year, we're in 4 different countries. Actually, we're going to Australia next month to teach and train those providers. They're so hungry to learn. So we have continuing education, medical credits for our providers. We certify them, and at this point, we have them all over the country. So if you're looking for a provider, we are gathering our list and putting them on our Hormone Makeover website or the BHRT Training Academy website. And here's what is so wonderful. There's so many providers that want to learn. They really do. And sometimes we have a negative connotation. Oh, my doctor didn't listen to me. There's so many that will. If you don't have a good relationship with your gynecologist or your family practice doctor and they tell you, oh, don't take hormones, go to another one. Fire them.
Right.
Go see somebody else.
Yeah, I feel like we get it's that breakup syndrome. We feel so loyal, and we don't want to hurt people's feelings, and it's your health care, it's your body.
Yes. And you're a great example of taking charge of your health.
Oh,
and
thank you. We have to. All right, Donna, I always ask every guest to give us a song to put on the KellFire Show playlist. So what would be one theme song that would resonate with you for your journey through the world of hormones and where you're at, what you've done in your life?
Well, the song that comes to mind is that song, Unstoppable. And the reason why I say this, and I hope that this will be an encouragement to women that have struggled in life. I've had a very challenging life. It took me many years to pull this academy together, but I've raised 4 children, mostly on my own. A lot of, issues of poverty, struggle. I finally found a wonderful man. He died. I married a cardiologist in my 50s, and then he died 7 years later. So many life adversities, like I'm not the only one. So I guess the message that I want to share with your audience is, if you've been through so many adversities and struggles and you can't imagine seeing the end of it, woman, get your fight back. You can do this. Rise up. Whether it's getting your hormones in balance or, taking charge of financial issues or whatever's going on in your life, don't stop. Keep going. You can do this.
That is the most amazing message ever. I love that. I wanted to get pom-poms out and be like, that's right, that's what she said. So, Donna, where can everybody find you online? Any social media websites, anything like that?
The Hormone Makeover. There's social sites for that. Donna White and BHRT Training Academy.
And the book, don't forget.
The Hormone Makeover.
Yes, get it today, right now. Thank you so much, Donna. I learned so much.
Good.
And I hope you all did too. If you love this episode, follow us on Amazon, Spotify, iHeartRadio. Where else are we?
Apple Podcast.
Thank you. See, that's why I brought on the expert. Apple Podcast, YouTube, and thank you again for tuning in. Hey everyone, I just wanted to tell you guys about our supplement line. If you haven't already heard, I put a lot of time and effort into sourcing out what I think are the most important things for women's health in this transition in our lives. And we have Dr. KellFire's potions and elixirs. What we have first is a vegan vanilla protein powder. We also have, this is one of my favorites. It's prebiotic and probiotic. It's a greens powder. So you get your greens, you get your fruits, but you do really attack that gut health and balance that out. So I'm a big fan of Thrive. We also have apple cider gummies. If you've ever had apple cider vinegar, you know how harsh that is to take. So we have our gummies, and they are apple flavored, and they're really good. Supports metabolism. We have the lovely collagen and biotin combo in liquid, so it's awesome. You can put it in your drinks, you can put it in your teas, you can just shoot it in your mouth. I love tinctures, but collagen biotin for hair and nails, because that is extremely important at this time in our lives. 8-in-1 mushrooms, illumination. I love this product. It's 8 different nootropic mushrooms that supports immunity, anxiety, mental state, awareness, focus. This is my favorite, baby. And then I probably shouldn't have said that, because this one is my favorite, baby. This one is bovine glandular. So this is derived from bovine uterus. This is for hormone balance and libido support. This is a staple, and I think it should be a staple in every woman's wellness kit. All of our supplements you can get on mytempesta.com. Just hit the shop link and everything there. You can get it one time. You could sign up for a subscription with discounts, and they'll just come to your door. It will spark your wellness journey and ignite your fire.